Assalamu alaikum everyone. Good afternoon. My name is Akbar Shah and I'm country manager for RB Hygiene. Let me quickly introduce you what RB is and what do we do. RB is a multinational. You can Google it and you will know a lot more. I'm going to just give you a very simple, some few numbers. We create simple, innovative products that make it easy for individuals, families and communities to live healthier and happier. It's a community of 40,000 entrepreneurs, as we call them. We are available across the world. Some of our brands which are known in Pakistan include Dettol, Harpic, Mortein, etc. We have over 50 brands and we have a market capitalization of around 60 billion US dollars. Our performance this year had been fantastic. We were one of the best performers in the peer group. Let me talk a little bit about our purpose, because RB is truly a purpose-driven company. We believe a business without a purpose is a business without its soul. Whatever we do in our business, we drive our inspiration through our purpose. And our purpose is to protect, heal and nurture in the relentless pursuit of a cleaner, healthier world. A world where access to quality hygiene, wellness and nourishment becomes a right and not a privilege of the few. When you talk about Pakistan, we look at our brands. Each of our brands, they have a very clearly defined purpose. For example, the challenges that our brands are trying to solve include a fight against malaria and dengue. We have a fight to provide access to cleaner toilets. There are 50,000 people who die every year because of poor hygiene, because of diarrhea. We have brands like Robin and Dettol trying to help on that front. And the COVID-19, where we are really leading from the front, whether it's Lysol in the West or Dettol in Pakistan. I'm going to talk about few of these social issues and how we are catering to those and how tech is really enabling us. Talking about mosquito-borne diseases, some facts. You'll be surprised to know that mosquito is the deadliest animal on the planet. It kills around 1 million people every year. In Pakistan alone, on an average, around 1 million people suffer from mosquito-borne diseases. These include malaria, dengue, chikungunya, and on average, around 20,000 people lose their lives every year. Pakistan has seen recently in the last 2 decades an increase in epidemics of dengue. The first time it was discovered, it was 1994, and then onwards in 2006 we saw a major outbreak. 2010 and 11 was massive, and last year also in 2019 we saw a huge outbreak of dengue. Like COVID-19, dengue does not have a commercially available vaccine and it's deadly. It purely depends on your immune system. The economic cost of so many people suffering from malaria and dengue is roughly around 20 billion rupees to the exchequer, to the taxpayer. And this is massive. This is on top of overall healthcare, the burden that we put on healthcare, around 1 million people looking for going to the hospitals, going through the labs, spending money on to recover. An average illness lasts for 25 to 30 days, and an average cost to a patient, even if the hospitalization is free, is 35,000 rupees. In a country where the per capita income is around $1,250 US, this is huge. And it's and the psychological costs, the job losses, the fatigue after the recovery are all on top. In 2019, last year alone, 55,000 people suffered through dengue. around 250 people lost their lives. So it's huge. We as RB, we looked at our brands. Morteen initiated a purpose-led movement called Dengue Ab Nahi, or Dengue No More. It was a very powerful campaign which is still going on. We had a social cause, we had a movement, and we had the credibility to stand for it. We had product solutions of different sorts, of different needs. A product which gives you a protection for 7 rupees per night, something which can really is affordable for the masses. We created this movement by working with health practitioners, hospitals, massive TV campaigns, also on digital, educating masses around the disease, especially in the time when there was a heavy rains post monsoon. Now, what we also learned through, while we were doing this campaign was we created very different content for different customized audience segments. We created a content which is providing credentials. We created content which is driving a movement, which we created a content which is empowering women. And we also experimented digitally with different product segments. There was a different product segment, and we could see the traction between different audience segments and different sort of product segments. And we could do that because digital really enabled us. Now, we could also see that certain socioeconomic classes preferred a certain segment, and therefore we redirected our resources around those product segments which were required in certain segments of the neighborhoods. We did all that, but we thought that there is much more that we can do. So we looked at data. We looked at big data for solutions. We looked at, is it possible for us somehow to predict dengue with a reasonable capability? And can we really empower individuals with literally with a 7 rupee per night kind of a machine to really safeguard them for those particular months when there is a potential malaria or potential high level of mosquito activity? We looked at satellite imaging. We looked at open spaces. We collected weather data for the last 8-9 years. We looked at some of the publicly available patient numbers from different geographies, and we figured out some sort of a correlation, and we came up with a logarithm which could enable us to really give us the dengue hotspots. We took that data, we worked with the government, we worked with National Disaster Management Authority, and we said, look, how can we partner together to really fumigate, allowing you to fumigate those areas where there is a high level of sort of mosquito activities and divert resources there. And also, we enable our distribution partners to drive the product based on the socioeconomic classes and the product needs to those geographies. So we had to really look at offline data with an online data to really create an ecosystem for the consumers. While they are engaging digitally, they can still buy offline, or they are engaged offline, but they can still buy online. So we really created an omni-channel. The result in 2020, our message reached out to around 100 million people. Our product reached to around 40 million Pakistanis. And this year, while the year is still going, we have so far around 6,000 cases reported on dengue and not more than 18 deaths reported so far. So that's a massive sort of a reduction around dengue specific cases in the country. We don't think we have done the job yet. It's a journey, it's a mission, and it's an issue which is being faced by many countries. Therefore, we're looking at how do we take this fight further. Now, taking this fight further, we are working on creating a real-time portal accessible to public to report water stagnation, dengue and malaria hotspots, where we could work with various government bodies, in real time to make Pakistan dengue and malaria free. Should you like to collaborate or have ideas around this, please reach out to Sarchana. Her email address is there, and together we can really make Pakistan dengue and malaria free. I will now take you to one more use case, which is around toilets. You will be surprised, there are some dirty truths. The dirty truth is that 41 million Pakistanis are without toilets. After India and Indonesia, probably Pakistan is the third biggest market, third biggest country where this issue is huge. Now, typically when you go outside, you ask people, where do you go for when there is a nature's call? They will tell you it's probably the nearest mosque, or if they are privileged to have a vehicle, they will probably look for a restaurant, or otherwise it's an open defecation, and it's a truth. But none of this is really available for women. None of this is available for girls or people with special needs or people who are not privileged to have a vehicle, and also for kids. As a result, the social structure, social construct of Pakistan is not very inclusive for women, for children, for transgenders, for old people with special needs, and they are kind of marginalized. It's a world, it becomes a men's world out there. On top, 55,000 people die in this country because of diarrhea. And diarrhea is not a disease which requires a vaccine and we are waiting for that vaccine. It just means basic hygiene, ensuring basic hygiene. Nobody should be dying from diarrhea. But the standards are not followed. There's a lack of awareness, lack of education, and therefore a big need to do something about it. There are some startling facts when we look at girls' education. We have looked at some of the data. There is an 80% drop rate for girl students when they graduate from class 6 to class 7. 80% of them who have passed the grade 6 exam will not go to grade 7. And one of the reasons is that they do not have access to a safe, clean environment. And therefore, the parents will pull them out. And that's what is happening. So therefore, 1/2 of our population is not being able to get to the work pool. So they are not employable because they haven't educated themselves. And really, when you look down, it's basically a lack of basic toilet. So it's definitely much more than toilet. Therefore, what we have done at one of our brands, Harpic, has started a mission very recently. We call it Mission Saaf and Safe Pakistan. It's a huge mission. It's a movement which is about enabling access to clean and hygiene toilets and bathrooms for everyone, regardless of age, regardless of whether somebody has a car or a bike or somebody is on a wheelchair. Everyone should have access to this basic need. So we can't do it alone. We are working with a lot of partners because it's a huge issue in the country. And I'll tell you some of it, what we are doing now. We are working with Clean Green Pakistan, the climate change, Ministry of Climate Change on the issue. Because this issue is not just education and not just health. If you look at our tourism industry, it depends on having access to cleaner toilets. Otherwise, the tourists will not come. We are also supported by Infection Control Society, a big body of healthcare practitioners. We are also partnered by ARY, also by CARrefour and Metro on ground visibilities. But most importantly, we started working with the Citizen Foundation, where we are going to educate kids about toilet hygiene, and we are going to educate janitorial staff. I'll jump straight to some of the how we are using data to drive access to cleaner toilets. We looked at again to big data, and we looked at different classes. We looked at where are the open defecation issues, where are the lesser number of toilets in the city. And you will be surprised if I tell you that there are only 22 public toilets in a city like Karachi. And many of them do not have proper water or sanitation. So it's a huge issue. And we could link it back to our brand's availability in those neighborhoods, and we could also sense that where there is an awareness issue. So we put all that data together, and we figured out some of the key locations in the city where the open defecation is really high. And based on that, we had put some public toilets in the city. We have recently gone to Orangi town. There's a place called Lee Market. So we had a street theater there where we engaged everyone from traders to union leaders to from law enforcement agencies, and we built a public toilet which has ramp, which has a place to change diapers. It's very women and girls and children friendly. It also is enabling people with special needs to access it, and also available for men. We could do that because data could tell us, pinpoint us, exactly the location where the issues are. Again, it's a big fight. Now, if you want to take this fight further, and if you are working on, if you're a social media influencer, if you are doing something on big data, if you have some good ideas around how can we take this fight further, feel free to reach out. Again, the email is there. And let's work together to create a cleaner and healthier Pakistan. Thank you.